Hi, this is Dr. A with the third and last installment of Chapter 10 on Information Technology's Impact on Healthcare. We are in the 5th edition of Basics of the U.S. Healthcare System from Nancy Niles, and this is Intro to U.S. Healthcare. All right, so we're going to look at applications, IT applications in healthcare. So we're going to start with telehealth. So telehealth is the broad term that encompasses the use of IT to deliver education, research, and clinical care. An important activity of telehealth is the use of email between providers and their patients. And e-health refers to the use of the internet by individuals or healthcare professionals to access education, research, products, and services. So there are several websites, such as, for example, WebMD or MayoClinic.org or ClevelandClinic.org. I like them too because they're like nonprofit and they're hospital-based, whereas WebMD is commercial. And then Healthline is also commercial, but they are a really great source of information. So they both provide consumers with general healthcare information, and if you want to look stuff up on these sites, they are very, very helpful and very detailed, and they do give a lot of information that can be readily absorbed or learned by the general public. Telemedicine refers to the use of IT to enable healthcare providers to communicate. This could be rural healthcare providers in, a tertiary health center or something, a specialist, and they're talking about their patient care, or the providers could communicate directly with the patients using telemedicine. So you can have remote appointments, virtual appointments. And this, again, all to communicate and coordinate care for a patient. So the basic form of telemedicine is a telephone consultation. This has been now more and more replaced with video conferencing because now we also have smartphones and email. We have email also and apps and things. So more people have access to technology and are able to interact with their providers using telemedicine. This can be really important for, let's say patients that are needing to be seen by a specialty hospital or something, and it's a checkup, and maybe they can do it virtually, and it prevent them from having to drive 2, 3, 4 hours to get to the provider, so it can save money and time for the patient, but also even for the provider. It can also deploy the specialty knowledge into rural areas without having to have providers that are located in those rural areas. So a good example of that is Avel Care. It started as Avera Health or Avera eCare, but they sold their telemedicine services, Avera eCare, by a private equity firm. They sold it to a private equity firm, and it was renamed Avel Care. So they have grown telemedicine. They really kind of pioneered and grown and have done some tremendous stuff. It has increased its telehealth. Now it offers services to 600 sites in 32 states. It started out in some of the remote states, and I can't remember, somewhere up in South Dakota, North Dakota, somewhere, where there's a lot of remote areas with lack of access to specialists. So they are going to continue offering the same services, which include behavioral health, correctional health, hospitalist, intensive care unit, pharmacy, school health, specialty clinics, and senior care. And I've got some of these broken down here. So their emergency consultations expand the ability of your emergency department to respond to immediate and or multiple unfolding situations. You have 24 access to board-certified emergency medicine physicians and nurses, and it's like a video conferencing thing. You can have the video camera in the consultation pod, like directly to the patient with a nurse, or a physician near them. They also work with EMS to expedite care and provide the best pre-hospital care possible to the community. They can support EMS personnel by lending a virtual hand when they need it. They can do behavioral health It provides emergency departments, inpatient behavioral health, and acute inpatient units with expert evaluations from mental health professionals without them having to come physically to the location. They can also help with crisis care that's supporting law enforcement and give them access to behavioral health experts to help de-escalate situations. They have hospitalists that deliver high-quality care and management of complex medical and surgical patients who are 18 years and older. Again, taking the burden off of the local doctors trying to manage it. ICU, there's the Avel Care ICU provides critically ill patients with 24/7 monitoring and support. It connects hospitals to board-certified intensivists for constant monitoring, faster interventions, and then also lower risk from complications. There is also a pharmacy one, so pharmacy and hospitalists can count on the pharmacy team to meet their pharmaceutical needs 24/7. They partner with local pharmacies and professional staff to ensure patients receive the safest and most effective medication management. They also have school health, entire school day nurses, and they help them respond to student needs. And so this is excellent because they don't have to keep as many people on staff. They also have senior care, so interfacing with nursing homes, and they can provide round-the-clock service to senior care residents to, again, improve care and outcomes. And for specialty, it's medical specialty care through high-definition interactive video, so we can access specialists, right? So this is really cool. So, of course, all of this has to be managed at the hospital. We should have a chief technology information or chief information office, which manages the organization's information systems. The Council for Affordable Quality Healthcare is a nonprofit organization of alliances of health plans and trade associations, and they discuss efficiency initiatives to exchange patient information. So again, another thing that's integrated with IT management, trying to make it better or bang for your buck. So as part of their initiative, they have created a committee on operating rules for information exchange called CORE, which borrows from the banking industry standards for one of the largest electronic payment systems in the world. So the cool thing about the banking industry figured it out, and they figured it out first, is like if you want to, you can send money to somebody, to a family member in Europe, in Africa, in Asia, or whatever, and you just have to have, there's a bank SWIFT code, which is an international banking code, their routing number, the checking number, and you can send money across the world and it gets there. It's pretty cool. So using those the system that we're trying to, again, integrate all of this health information to where your records could be sent across the country if you are across the country, right? So as part of the required data standards mandated by the Affordable Care Act, CORE is being used for data exchange of electronic health records to ensure compliance with HIPAA and other standards. So enterprise data warehouses are developed to provide information that helps organizations in strategic decision making. So data warehousing requires this integration of many computer systems across an organization so all the data can be aggregated and looked at together. The Veterans Affairs EDW is one of the best in the nation. It has corporate data warehouse with 4 regional data warehouses. And so this is what we're trying to do as well as they are. CMS established its own enterprise data warehouse in 2006 to improve the management of all its insurance claims. So let's look at we'll look at more random applications of IT. So RFID, radio frequency ID chips. So normally they transmit data to receivers. Each chip is uniquely identified by a signal indicating where it is located. So for example, Walmart was one of the first retailers to use RFID to manage its massive inventory. Hospitals can use RFID to track medications through the system, as in where it's at, if it's in the pharmacy in the Pyxis system, or maybe the nurses have it on their cart or something. You can track patients across hospital. You can put RFID in name badges for employees and track employees all over the hospital. Anyway, you can track major medical equipment that way. Anyway, if you can put a tag on it, RFID tag on it, you can track it. Now, Phreesia Pad is a wireless digital device with a touchscreen keyboard and allows the patient to enter their demographic information and then the reason they are visiting the doctor. So it's like a virtual check-in. You get in, you get to the doctor, walk into the waiting area. I wanted to see this waits for you. You can actually check in, especially if you have an appointment, tell them you're there. You can, again, this eliminates your need to replicate all the information, write it on paper again, and just do it all. And now there's even more and more. I get notification on my cell phone if I have an appointment, and I can check in through my chart or whatever and fill out all the information needed at least a day or two ahead of time even. So the Phreesia company currently manages intake for over 100 million patients annually. The system includes setting up appointments, having mobile in-office registration, clinical support, and patient surveys. Approximately 30% of patients leave their clinician's office without making any payments. So this can help solve it. This also is with apps. I've noticed that nowadays, and especially in this past year, when I do a lot of the early check-ins, it asks you, hey, do you want to go ahead and pay your copay right now? So 2 days early. You haven't even been anywhere near the clinic, but please pay your copay, right? And this helps them to collect all of these copays because it takes to practice an average of 3.3 billion statements before a patient's outstanding balance is paid in full. And so this, system can help, fix some of that. All right, patient points. It provides education to patients electronically while in the waiting room or an exam room. It's usually a TV up there on the wall, and it's running these ads or these, educational videos and things. So it can be customized with brand advertising messages that are displayed on digital flat screens in physician waiting rooms. It partners with 8,000 local advertisers nationally to ensure the marketing is customized. And it has programs in over 38,000 physicians' offices, 500 hospitals, and over 140,000 other health provider types. All right, so let's talk about robot technology. So robots can be used for surgery, for inventory, for patient checkups, or patient care even, and for enhancing patients' lives. The use of robo-assisted surgery was developed by the Da Vinci system nearly 20 years ago. I remember when we got our first Da Vinci system at the hospital. Although the robot itself is controlled by a surgeon and it takes some training to learn how to operate it, it does lessen the risk of surgery because there is typically less bleeding, smaller incisions, and less risk of infection. More companies are developing robot-assisted surgery products because of these factors. It also increases the cost of healthcare. I would say like a robot surgery is more expensive than traditional surgery, but you also look at the benefits and it can be worth it. There's also telepresence robo-surrogates. They've been developed so physicians can consult across the world regarding patient care. It's very cost-effective and that less burdensome on a physician to travel across the country or the world to consult on a difficult case. Again, allows some of this virtual consultation stuff to go on. Due to the nursing shortages, there are also robotic nurses. They've been created to do menial tasks like moving carts or gurneys from room to room or other very basic tasks that need to be done. And then we also have pharmabotics. So it has recently received a hospital approval. So it's a massive vending machine with drugs that is being retrieved by a robot instead of a human. We do have already the big vending machines for drugs and things like that in inventory and all kinds of things. And they're behind the system, and you have to log in and key what you're going to retrieve, who you're going to give it to. But the fact that you're replacing the human with a robot, it also eliminates human errors and theft of inventory. So unfortunately, especially with narcotics, nurses could potentially go in, say to a patient, I'm taking, a pill for Mr. XYZ, and they note it as that, and then actually never give it to that person, keep it, take it themselves, or pocket it and sell it later. Advancements in prosthetics is also the result of researchers creating robotic limbs that can adjust their joints 750 times per second. There's been some really cool robotic limbs that really help with those that need it. And researchers have even developed neural implant systems that allow feedback to the user so the limb can be controlled. So again, such improvements. We also have robotic exoskeletons that provide the support needed to paralyze or weak muscles to enable patients to walk again. And there's a recent medical robot use has been delivering drugs to target areas such as a tumor. And the drugs are delivered by mini micro robots that are steered by magnets to a targeted area. How cool is that? Now, the Sapien heart valve is another new technology. So it's a life-saving alternative to open heart surgery for patients who need a new valve but are at high risk for surgery. It's been available in Europe but was approved for use by the FDA in 2017, and the new 2020 version has been approved also. So the valve is inserted by a catheter from a small incision near the rib cage, which is expanded by a small balloon, and it is put into the valve space. And since its development over 15 years ago, it has been implanted in over 763,000 patients in 75 countries. The Piccolo Express Chemistry Analyzer, bringing your entire chemistry lab to a little bitty, small analyzer. So it's the size of a shoebox. It's compact, portable chemistry that quickly delivers blood test results. It can print a hard copy report in 12 minutes, or it can send the information to be transferred to an AHR. This is really cool. It's really neat. You do have to understand its limitations. We have one of those in our little lab. It can only run one patient at a time. So if you're in a small clinic and you need something to do some testing here and there, that's great. If you're in a large hospital, this is not going to work. So the importance of health information technology. So in a study on HIT implementation in management, the Sudolsky and Smith interviewed 6 hospital CIOs and nurse managers to assess why they use health information technology. So the CIOs indicated to use health information technology to streamline administrative processes in the organization. Again, saving money, saving time. They all recognize the substantial cost to invest in health information technology, but then understand this is a long-term investment and it would ultimately be really cost efficient. The nurse managers focus on the ability to reduce medical errors. They also indicated that having electronic patient data ultimately contributed to more efficient and effective clinical decision making, because you can see previous results. You can see what their history is. Like all the information is easily found. It's linked together, and so this really helps integrate the whole patient picture for nurses. So artificial intelligence and health information technology have provided tremendous assistance to clinicians in diagnosis and management of their patients with the drug-drug interactions, the clinical decision support system, the computerized physician order entry, and all these other tools. They've all had a positive impact on patient and management care. It is true that the providers are spending more time on the computer, but it's really long term again, and with the big picture, is really improving healthcare. So in conclusion, the major IT issue in healthcare is the need to establish this interoperability of all of these EHR systems nationwide. It should be able to go across all the nation, anywhere you are. And so they started by establishing the health information exchanges in the regional health information organizations. So this is the first step that we need to this interoperability, at least in a geographic area, and then we can expand it to the nation. So this communication between systems then will enable patients to be treated more quickly, because there will be immediate access to their most current medical information. And then, what if they're unconscious and you don't even know any of their medical information? Being able to access this then really can get you all the information so you can give that patient the best care. So full use of electronic health records nationally will also expand the success of telemedicine nationally. But there's always criticism. What if it's hacked? What about the security? You have to spend a lot of time entering that data and sifting through, and who's looking at all the big data, who's making these large strategic decisions, what are we using? And the clinician and administrative staff can have some burnout being on the computer all the time. So good stuff, bad stuff. I think the good outweighs the bad, but you have to talk about all of it. Okay, so that wraps up our IT chapter. And our next one coming up is going to be about law in health.